to the next presentation. Thank you.
Thank
The
you.
next presentation, entitled is ARID1A Involved Tumor Genesis and Severity in Hepatocellular Carcinoma, presented by Mr. Pongpraphart Yobunyong.
Okay, good afternoon. My name is Pongpraphart Yobunyong and I'm a third-year medical student from Sirindhorn University. Today I will be talking about is ARID1A involved in tumor regenesis and the severity of hepatocellular carcinoma. Well, this is hepatocellular carcinoma. It is the cancer that is associated with poor prognosis and bad outcome of the patient. It is also one of the most common cancer you can find in the world. In year 2020 alone, there are 830,000 deaths concerning the liver cancer, which will jump by 55% in year 2040, according to the Global Cancer Observatory. What about its role in Thailand? This cancer claimed as the most common cancer you can find in men and fifth in women. So, the way that we can verify that the patient have HCC is by biopsy, which is invasive, but the medical community tried to go for more or less invasive techniques, which will be the biomarkers. But as there is no definitive biomarkers for HCC, we would like to present some possibilities. Then that possibility is ARID1A. ARID1A is the AT-rich interaction domain 1A, which acts as a tumor suppressor. It's functioned by altering the chromatin structure, which in turn arrests cell cycle. Well, this particular ARID1A seems to involve in different types of cancer, which for the left group is like the GI cancer group, and the right is the reproductive system group. But today we will be focusing on the HCC. As we have passed through all the databases, we have seen that the popularity or the interest in HCC and ARID1A seemed to start in 2012. And then you can see the trends of its popularity rise up as the year goes by, especially in year 2021 and year 2022. Applying all these criteria we have and using 3 keywords, including HCC, ARID1A, and diagnosis, we have found 43 articles. But if we only use 2 keywords, excluding the diagnosis, we have found 115 articles, which we will be focusing on that. So the result that I will explain will be divided into 2 groups. The first one is ARID1A involved in HCC genesis? And the second part is ARID1A involved in HCC severity? Well, the first part is it involved in genesis? We have found 4 papers that support the idea that high expression of ARID1A seems to connect with HCC initiation. So high expression of ARID1A seems to have some interplay with tumor initiation of HCC. The second part is ARID1A involved in HCC severity? To explain this, we have constructed some new grading system using the BCLC, modified Edmondson-Steiner grading system, the TNM, and some more additional criteria. And ARID1A seems to play some part in hallmarks of cancer. For example, in the sustaining proliferation signaling, the tumor promoting inflammation, the activation, invasion, and metastasis, and to induction of angiogenesis. As we have extract all of these data, we have constructed this split bar graph. The vertical axis represents the numbers of publication. The horizontal axis represents the HCC severity grading. The red box represents the numbers of publication that talks into high ARID1A expression. And the dark blue box explains the low ARID1A expression. As you can see in this graph, you can see that the low level of ARID1A expression seems to have connection between itself and the HCC severity. For example, in the second column, you can see that there are 11 papers that support the idea that low expression of ARID1A seems to increase proliferation and angiogenesis, while there are 2 papers that support the idea that high ARID1A expression increase proliferation and angiogenesis. And this result that low ARID1A seems to increase HCC severity seems to goals as well as in terms of invasion, migration, metastasis, the reactive oxygen species, the anti-apoptosis properties of the cell, and increase in immune response. So low arabinate expression seems to link with the severity or the advanced stage of HCC. So this is from our speculation of the relationship between ARID1A and the tumor progression. Well, at the highest peak, you can see that we have found that in human, the tissue that the HCC tissue contains more ARID1A than the normal tissues. And then you can see that after that, as the tumor progresses, you can see that the level of ARID1A expression decreased. The reason that we think that is happening is because ARID1A is a tumor suppressor. At the first stage of cancer, we think that the cell tries to auto-protect itself against the tumor. So hence, the high expression of ARID1A. So high expression of ARID1A seems to have a play in the tumor initiation, and the low level of ARID1A expression seems to tie with the advanced stage of cancer in the terms of proliferation, invasion, and metastasis. So, what's the future of ARID1A and HCC? We think that ARID1A has a lot of potential to be the biomarkers of HCC, especially in terms of using it to stage the tumor, because this study, we can target drugs at different stages of cancer if we have less invasive and more high efficacy. We can determine this stage more proficiently, which helps to cure the patient. This is our references. This is our acknowledgement. And thank you.
Thank you so much.
Excellent work. Now, we have any question from our judges on site?
Okay, thank you, Kap. I was wondering about the study that you gather, that you put in the chart. Are they same design? Are they clinical study or are they preclinical studies?
Well, there are varieties of study we have to include because this area of study is relatively new and we have like few studies. So we include both RCT and some cohorts, including both humans and animals.
And then is the number of the subjects in those studies the same or not?
The numbers that in those studies is not the same.
Okay, so it varies among studies, right? So I'm not sure whether we can graph it in the same way that you did, because every study have different number of subjects. Therefore, if you quantify it only into study level, it will be a little bit misleading. Thank you.
Okay, thank you for the question and suggestion.
Thank you. Are there any more questions from our judges in both on-site and online? Thank you so much.